sleep. It's something that we look forward to each and every night when we put our head down on the pillow. But oftentimes, it just doesn't happen. We toss, we turn, we just can't fall asleep. So we get up, maybe take medication, or drink a warm glass of milk. But these treatments can have their own side effects. The topic of insomnia was very interesting to me because I oftentimes have problems falling asleep. And I wanted to know if there was something else that I might be able to do besides having to rely on medication or other forms of treatment. Particularly, I wanted to know whether chiropractic treatment could enhance the ability to fall asleep at night. So I did some research. Now this topic should be relevant to all of us because at one time or another, all of us will have problems falling asleep. Studies have shown that lack of sleep can cause issues with our mental abilities, our physical abilities, even our socialization. They found that people who are divorced and separated, those who are older individuals, females, people with anxiety or other medical comorbidities have problems falling asleep. One big area being stress, which we all have been experiencing over the past several months. So in order to learn more about this treatment, I began research and looking into chiropractic. There are several different areas which I reviewed. First, fourth ventricle compression treatment, which is also known as CV-4, cervical spine chiropractic manipulation, and cervical manipulation on patients with mechanical neck pain. So first, we will look at fourth ventricle compression treatment, which targets the brain and the cranial nerve function. The first study was done by Cutler and Associates, and they did this technique on their patients, or they studied their patients who had this technique. And they concluded that sleep latency and muscle sympathetic nerve activity did decrease. However, Kingston and colleagues came along and reviewed this study, and they were not able to substantiate the results. In matter of fact, they found that the results were mostly anecdotal evidence. So although there was no significant results with the CV-4 technique, there were other techniques that have been studied in relation to sleep and chiropractic treatment. The next one is cervical spine manipulation. McDonald did a study with males and females over the age of 18 who received cervical spine manipulation. And they received this treatment for a period of 2 weeks, 4 times each week. They did find improvement. However, they questioned whether or not the improvement was a placebo effect versus actual result of receiving the chiropractic treatment. So with no evidence again for sleep pattern changes with the CV-4 treatment and the cervical spine chiropractic manipulation, I dug deeper into this topic. The next study I found was related to cervical manipulation treatment, specifically on patients with mechanical neck pain. This study was done by Matlela. This researcher did non-comparative quantitative study with cervical manipulation therapy on patients with mechanical neck pain. The patients were treated, they were 30 individuals between the ages of 18 and 40, and they were treated 2 times per week over a period of 3 weeks. They used a scale called the Pittsburgh Sleep Quality Index, or the PSQI, and they gave the the participants this study or this scale prior to the treatment and following the treatment. And they noticed a 53% decrease, which indicates that there was an improvement in sleep. However, patients also exhibited a decrease in their neck pain. So it could not be definitively determined that the improvement in sleep was because of the chiropractic treatment itself or because the patients were not suffering from the neck pain as much. So, as you can see, there have been several studies conducted in relations to chiropractic treatment and its effect on sleep latency. From Cutler et al., who did the study with the CV-4 treatment, found some success with improvement in sleep. However, Kingston and colleagues were unable to substantiate this. McDonald, who did the cervical spine treatment, who found some improvement, but weren't able to rule out a placebo effect. And then finally, Metlela, who used the cervical spine manipulation on the patients with the neck pain, found some improvement, but couldn't determine definitively whether it was because of the chiropractic treatment or the improvement in the neck pain. Sleep loss is significant for all of us. It can affect us in many different ways. So it's important for us to try to find alternative solutions in order to take care of these issues. Newer research has been suggested to look at mechanical receptors of certain neurons that are thought to be released when a patient receives chiropractic therapy. And they are positing that this can cause a relaxation in the mind and promote REM sleep. So there is some new promising research coming out there that may show that chiropractic treatment can be effective in reducing sleep. But we'll have to wait for that. So next time you are sleepy and you drop your head on that pillow and you try to get some sleep, maybe in the future you'll be able to find an alternative solution to solving that issue other than having to take some form of medication. And that would be chiropractic therapy. Thank you.